Good afternoon. On behalf of the MPCHB program, I will be talking to you today. My name is Ayanda Gcelu. I work at Groote Hospital and at UCT, the University of Cape Town. So today we are going to be talking about the MPCHB. So what we would like to do today is to interact, with us. So I would like you to have your smartphones or devices, ready, with the browser open, and please type in menti.com and wait for me to give you the code, and then you can interact. When one studies medicine, you actually study 2 degrees. So it's called the MPCHB program. And it is made up of the Bachelor of Medicine and the Bachelor of Surgery. As you can see, the MP stands for medicine and the CHB stands for surgery. So this journey is a 6-year journey. So hence, it is long because it has 2 degrees. So please use your smartphones and type in menti.com. And the code is, as shown there, 69599712. So what I want you to know, from you is what qualities do you think are important for being a doctor? So, just, jot that down. Let's see what, people are coming up with. I think, with each and every profession, there are certain qualities, that are important for that particular profession. So what do you think are the qualities that are important for being a doctor? So let's see what people say. So I would actually say I was interested to see what people would come up with. But what I would say is that being a doctor, is, carries itself, as a serious, it's serious on its own. But, what is crucial, is that, you must be able to communicate. So I would have wanted to see communication, being one of the major qualities, because if you can't communicate as a doctor with your patients, if you can't communicate, with other professionals, then it becomes problematic. And also, you must be patient. You must have empathy. You must be able to put yourself in the shoes of, that particular patient. And you must also show some care. But one of the important qualities as well is listening. So sometimes patients, they said, well, I've been to a doctor, but, this doctor, was not listening to me. So if a doctor cannot listen to the patients, then it becomes a problem. So the doctor must be able to listen and have wisdom and be more enthusiastic. Thank you. So as you can see there, all these things that I've mentioned, empathy, communication, care, and also people are talking about critical thinking, which is important. You must be able to work hard, to be passionate, and also, you must be willing to continue studying. You must be willing to continue reading, so that you are up to date, with your data, what can go wrong, what new medication comes up. So I'm so happy to see words like patience, caring, empathy, communication, coming into play. So if you want to be a doctor, think about these qualities. Thank you. And one of the important things is that when you come to UCT, yes, you will have all these background qualities, but what is important is that at UCT we teach students to be more than the knowledge that they can acquire, and then we teach them more than the skills that they can acquire. But we teach them to become a professional. So we do understand that, there is a transition from becoming a learner, from being a high school graduate to becoming a university student. But we will walk the journey with you and try to engage you in a range of collaborative learning strategies where we'll embrace, technologies, that, will equip you, for the future. And you learn, to communicate, with other professionals that are available especially important, in your profession. So that is important, an important attribute, to have. And also, being a professional means that you learn to work, with patients, professionally, work with other people professionally. So at UCT, we will guide you in an experiential learning approach that will introduce you to all, these skills. There is a course, that is called, Becoming a Professional, where you learn, all these things, how to be a manager, how to be an advocate. And also, you learn to appreciate, the basis of public health, as we've seen, with COVID-19, that, it's one of the important attributes, because you will be working with multi-professionals. So now the question is, are you curious, to work, with people? Are you curious, to be in touch, with your community? Are you curious, to put yourself out there? Because at UCT, we start, from the very beginning, to engage you, with the community. You start seeing patients, early on. There are organizations like Shoko where students go and see as early as second year. They can go and see patients, but of course, in the guidance of professionals. So, the question is, do you want to have, a human connection? So I would say, choose UCT. So once again, I want you to go to your devices and type in menti.com, and the code is as shown there, 69599712. And I want to know what are the career options one has once, they qualify as a doctor. So what is it that, a doctor, can do? Once, you get, your MPCHB program, what is it, that, you come up with? Can you just remain a doctor with your MPCHB program? Are there any things that, you can do later on? So, once, you qualify as a doctor, I'm interested to see what people come up with. But once you qualify as a doctor, that you have your MPCHB program, you then do 2 years of internship and 1 year of community service. But you must not be worried, because when you are doing your internship and your community service, you will be paid as a doctor, because you will be working, seeing patients. But, this is, in the guidance of other trained, professionals, other doctors that have been there for many, many years. But then once you finish your community service, then you become what is called a general practitioner. So when you work in private, people, they refer you as a GP, which is your general practitioner. But as a general practitioner, you can also work in a hospital where you are a medical officer, where you can work in a clinic, you can work in industries like the pharmaceutical industries as a general practitioner. But you can also teach in academia when you finish. You don't have to go and see patients, but you can teach in academia. But also you can upskill, yourself, with diplomas as a general practitioner to keep up to date, and also, follow what you are most interested to do. But you'll be seeing, as a general practitioner, you see every person, from children, to adults, pregnant people, and all sorts. But if you don't want to remain a GP, you can study further and become a specialist. So, this is like studying 4 years extra. And then there are many different clinical specialties one can choose from. And if you are still interested, to go and refine, your specialty, you can subspecialize. And then there are also about 30 and above subspecialties that you can choose from. And also you can be a researcher. You can do a master's, your master's. You can do your PhD. And work in many different areas. So, this means that, once, you become a doctor, once you become a doctor, you can do a lot more, than just seeing patients. If you don't want to see patients, you can do a lot other things. And also, within the specialties that you choose, you can choose what you are comfortable to do. Are you comfortable to work more with patients? Are you comfortable to work with with children? Are you comfortable to work in the lab? All these are within your within reach. So that is important. And the question now is, what is it that you need to qualify, in order to apply? What are the minimum requirements that are required, for you to join, the MPCHB program? Of course, these are minimum requirements. English, 60%, mathematics, 60%, and physical science. So these are mandatory subjects that you need to do. And all these, and so once you get your score, depending on whether you get an A, B, C, then you get a score. Then you formulate what is called an academic point score, and the minimum points are 450 points. And then also you will be required to do your NBTs, which is your intermediate, the national bench test, which is it's a national test, that people do. And with this, you need to get on the intermediate range, not on the lower range, for you to be considered. Of course, what is important is that these are minimum requirements because of competition. Many people would want to do medicine, and then you need to work harder, but these are the minimum requirements. So, you want, to come to UCT and be fearful and to graduate as a doctor, please, we will welcome you. Choose us and choose UCT. So now, with me today, I have a past UCT student, Dr. Sakina Ibrahim, who is now a specialist. So I would like, Dr. Ibrahim to tell us and describe, her journey, through the MPCHB program and give us highlights, challenges, and also, things that, she would have liked to have known beforehand. So Sakina, over to you.
Thank you very much, Ayanda. So my name is Sakina Ibrahim. And I'm a specialist physician within the Department of Medicine at UCT and Groote Schuur Hospital. I started my medical training in 2004, and UCT was my first choice as I was from Cape Town, and I'd only heard good things about their program. It was quite challenging adjusting to university life, obviously coming from high school, but the lecturers and the staff quickly made us feel at home. They were always ready to help us. I spent the first 3 years mostly on upper campus and med school, where we sort of gained a sound theoretical knowledge basis. We were also involved in various group learning activities like problem-based learning that prepared us for our clinical years, but it also introduced us to the concept of teamwork and becoming a health professional within South Africa, as you had mentioned before. The real fun started from our clinical years onwards, which was 4th year. We traveled to various peripheral hospitals and did some training at Groote Schuur Hospital. And this is where we were introduced to our Shawco clinics. And I think one of the highlights was spending time in the Shawco clinics, going into rural areas for clinics as well as our elective settings. I felt like UCT was home. So for my internship, my community service and medical officer time, I spent it all at UCT affiliated hospitals. And it was the obvious choice for me that I decided to do my specialist training through UCT. I completed my training in 2019 and I now work as a clinical lecturer for UCT, so within the department, as well as a site convener at Mitchells Plain District Hospital. I think the most challenging part for me was the initial adjustment to university life, but like I said, our lecturers and the staff made us feel at home and helped us to adjust with that. And I wish I'd realized that I should be enjoying my time more at university, because in the end, all the hard work does pay off. Thank you.
Thank you so much, Sakina. So the question is, are you curious about the notion of being and becoming? Do you want to become a professional? Do you want to become a healthcare superhero? So I urge you to choose UCT. This is where you become a hero. Thank you very much.
Thank you so much, Dr. Gcelu. In terms of questions and answers now, I see that there are a number of questions. There's an interesting question around, can you become a doctor if you can't stand blood? So maybe you want to either you or Dr. Ibrahim to answer those while I find some more questions for you. Thank you.
Yeah, I would say that you must be able to stand, blood to be a doctor, because that is what you are going to see at some point. I mean, it's not all the time, but at some point in your life, when you are training, you will be immersed in various areas, and some of them include seeing blood. So I think it would be very challenging, for someone who is scared of blood. But I think, there's also so many other things, that we are scared of. I was scared of someone who is dead. But, I soon, found ways when I joined the program.
Thank you so much, Dr. Gcelu. So there are quite a few questions about specialization. So there are a couple of things around becoming a forensic scientist. Is obstetrics and gynecology offered? And I think there were one or two others around specialization. Would you like to just answer some, just broadly around specialization?
Yes, a specialization involves, various areas, medicine, general medicine, when you want to be a physician, or, you can be a surgeon, you can be a pediatrician, obstetrics and gynae, you can choose, forensic medicine, is also, one of the specialists that, is there. So, there are a lot of, I don't think at UCT, I think, we have all the specialties that one, can have. There are various specialties, and then later on, you can refine, your specialization if you want, to concentrate on a smaller area in the body. But yes, we do have forensic medicine, obs and gynae, and also even within obs and gynae, when you want to study further, you can refine it to concentrating, with fertility issues, etc.
Thank you very much, Dr. Gcelu. And I see that there are a number of questions around applications and how to apply and how to improve your applications. So I wondered, perhaps I'll answer that question briefly. So colleagues, those of you may remember me from the first session, looking at I presented together with the Dean around the Faculty of Health Sciences, and I'm Dr. Kieran Bigg, I'm the undergraduate Deputy Dean. So there were a number of questions from you all around how to get guaranteed entrance and what subjects. Those questions have been answered in the chat, giving you the references to the undergraduate prospectus. And just a reminder that the minimum criteria there is a minimum criteria for us to even consider your application. So during the course of last year, we had close to 20,000 applicants for the 435 places that we have at the beginning of every year. So it is a challenge, and unfortunately more people will be disappointed than will be happy, but we'd love you to apply. And the way of really making sure that you can reach your dreams is to make sure that you do the best that you possibly can do in each of your exams going forward, and that will be predominantly for undergraduates. For those of you who might already be studying something at university or have finished a degree already, you will be considered as tertiary applicants, and there are some places set aside for tertiary applicants, but once again you will need to do exceptionally well in your undergraduate studies. And so you really just need to be looking broadly at those kinds of aspects. So please go and have a look carefully at the prospectus around Band A, Band B, and Band C requirements, as well as your NBT requirements, and just really do the best that you possibly can. And then please do remember that there are all sorts of other options. In terms of transferring into medicine, please have a look at the tertiary applicant requirements, which are also fairly stringent, and we really do hope that that it's a wonderful opportunity for you. I'm going to hand back to Dr. Gcelu and Dr. Ibrahim just to make a final the final statement before we close this session. Thank you so much.
Thank you, Dr. Beck. I urge you to choose UCT because at UCT you become rounded, well-rounded. Knowledge, is there. Skills, you will learn, but you learn to work, with people, in the community. You learn to work with multiple, professionals. They are at your fingertips, so to say. So please choose us. Would like to have you. Would like you to come to UCT. Thank you.
Thank you. Yes, I think UCT is a centre of excellence. You will be trained by experts in their field of study, so consider it a very good option to apply to.
Thank you so much, colleagues, and please go to the website, to the prospectus, and just do the best that you possibly can. And we look forward to greeting you and meeting you at the Faculty of Health Sciences in 2022. Thank you so much for joining us.